It's a great
Here we
pleasure
are,
to
yes.
be in Munich and to work for Teoxane as usual. As you know, I'm very faithful to this brand, which I like very much. And so, let's go to work because they give me 1 hour for 2 patients this morning, so we can't chat too much. This lovely lady, Petra, is 50 years old. She hasn't had too many treatments in the past, just a little bit of filler in the nasolabial fold, a little bit in the fine line, that's it. The first thing we have to assess is the geometry of the face. It's quite easy, basic. You can have a square face, like she has, which means the distance between the cheekbones is quite equivalent to the jawline here. Okay, so she has naturally a square face. You have triangle face and you have oval shape. So today we are dealing with a square face. As you can see, I've drawn some anatomical unit in her face, the temporal area, the eye socket area, the mid-face, the cheek, and the mid-lower face, chin area. Obviously, she's lost. You can see that she needs a bit of volume in the temporal area, which we're going to restore. She has a problem with the eye socket area. We had this malafat, the muscle, the orbicular muscle is a bit saggy. It's difficult. It needs something which is not fillers. We need essentially this new high-frequency ultrasound technology or eventually a bit of surgery to uplift this. But it's going to be difficult to deal with fillers. She lost volume in the mid-face, lost volume in the mid-lower face, and in a bit, maybe I will have to adjust the chin, definitely the lips. She has a very difficult upper lip, very thin, turning in, so not very easy, and the lower lip. So it's quite interesting. Her lips and the upper lip are very interesting today. I would say more than normal because we're going to use the new RHA2. I love this product. For me, Teoxane Global was the kind of benchmark or the gold standard of hyaluronic acid for the minor details. And I think now RHA2 will become the gold standard of all the hyaluronic acid fillers for lips and lines. So I'm going to use some different brand of the Teoxane range. We're lucky to have different viscosity, different thickness, which allows us to work in different areas. I'm going to use some Ultimate in the temple. Then I will use some Teoxane Ultra Deep in the mid and mid-lower face for the cheekbone and the mid-lower face. And RHA 1 and 2 for the mouth area. 2 for the lips, 1 for the lines on the upper lip. So we start, I made an anesthetic dot here. I don't know if you can see it. 10 minutes ago to make it easier for the patient and for me and for the demonstration. So needle hole, cannula 22 gauge, in, quite deep. You see where I am here now already? Quick, above the eyebrow. I'm going to do a brow lift. And I feel the temporal area quite quickly. Fan technique. Bim, bim, bim. With Ultimate. Ultimate is great because Ultimate would last minimum 2 to 3 years in this area. So, lucky patient, she won't have to have this procedure too often. Okay. Done. It's quite deep, in fact. It didn't look so deep. In fact, it's quite deep. Okay, I'm going to lift the brow again. Look, you make a brow lift. It's a very interesting way to do it. Done. As usual, we have to do the massage. Give me a wet swab, please. That's the temple. Massage. Okay, Teoxane Ultra Deep now. From the same hole, but not with the same depth. Same hole, needle hole, but a bit more superficial. Yeah, keep that on the side, please. Same thing. I changed the cannula. I could have used the same cannula, the 22, the 23 or 22, I don't know. It's quite the same. So, show you. the interest with this blue cannula, I have a mark which shows me where the filler is coming out, here. So keep your chin up. Position is very important, position of the patient and your position. As you can see I'm quite here. So I'm going to feel the area I've drawn. I try to push my hands for the cameraman to see. See? I don't go in the eye socket. You see, that would be a mistake, because then they will have some bubbly gel popping out in a few days if I do that. So I try to avoid this area, because when she sleeps, she can push with the, your head on the pillow is pushing the filler. You have to be just quite gentle. Now, I could carry on and do the filler in the lower cheek here, but you see, I'm quite limited. And I don't have the right axe. So I'd rather change. Prepare some more, please. I'd rather change and use a more vertical approach from underneath, which will allow me to join the other area. I prepare the same thing, a little anesthetic dot here, you see, pim. Simple, quite easy. Position again is very important. You're going to work from underneath, chin up. You have to push with the other hand, make an extension. You work vertical. You see, I go from here. You see, the other hand is tightening the skin, very important. Then you see exactly the right depth. And then I join up my... okay. Same thing. It's tight. Up. It's all fine. Okay, I want to control what I'm doing. Stay with me. So put my finger inside. Open your mouth, please. I want to check if it's quite even with my fingers. Okay, I spread out. It's quite even, I'm sure. I'm fine. I'm going to feel the chin area. I use a different type of cannulas to show you. This is a 27 gauge 45 length cannula. I make a needle hole here. It's easy. Yes, please. This one. You see, go in. I have a mark to show me where. They're quite nice, these cannulas. It's still Teoxane Ultra Deep going through a 27 gauge cannula, so it's a very flexible product. That's my, as I said 2 years ago, is by far my favorite. And I can also push forward the chin. I have two ways to do it, or maybe I'm going to use a quite superficial way to do it today. Just a small needle hole to show you. Again, all this is invisible, of course. In and out, you see, voila. Again, you see, I'm going to push forward the chin, slight projection. She doesn't need too much. She needs a little readjustment because she has a very strong nose, very thin lips. So we need to readjust all that. Okay, hold on. Maybe you can have an idea if we compare one side versus the other one already. Here.
Yeah. Yes. Now we can see great. Yeah,
Cheeks,
it's fine.
Cheekbones, it's fine. Chin area.
Fine.
Now I'm going to work on the lips now.
Fine.
Alors, RH2, the new one, I tried it like a couple of months ago. I honestly love it. It's so fluid, flexible. It has a great plasticity, and I think it's the perfect product for the lips. There is two ways. She has difficult lips because if you just highlight the outline, you may have you may increase the problem of the lips which are turning in like this. So if you just highlight the outline, it might be worse. So you need to have more juiciness, more redness, more red. So there's two different techniques to do that. I'm going to show you. So you have two options. Let's do the red part. I can show you. On one side, I'm going to do the outline. On the right side. Can you see? Try to. It's quite technical, so I'm going to try to be more precise. Can you see? So I focus on the outline. You see here? Voilà. See the outline? You see the whitening of the outline? Can you see it?
Yes.
I hope. Okay, let me know if you don't see it, because I don't know what you can see exactly. And I have to show you something interesting. That's the outline again, the bleaching of the outline. Okay. All right. I finished the outline on one side. As you can see. Okay, now I'm going to do the red part.
Dr. Sebagh?
Yes.
The question is which material, which product do you use?
RHA 2.
RHA 2.
Okay, now look, I want to plumb the redness, which is different. So I'm going to put my needle slightly differently. I reverse the lip. Okay, I go in with my needle. It's a 4mm needle. It's very important. Okay, forgot to tell you that. It's a 30 gauge by 4. You have different size of 30 gauge. You have 30 gauge by 4, by 6, and by 12. The classic is by 12. This is the 4 one. Look, in. I go in instead of staying. And now I'm going to inject inside. Do you see what's happening? And I'm going to sculpt, press. I hope you see the difference.
Yes, we see it.
Okay, same thing, 2 dots. See, quite deep. Voilà. Can you see? Okay. Now, you can see the two lips are different. If you check, can you check without?
Very good, yes.
You see the difference?
Yes.
You see, you have it's much fuller here than here. Now, I'm going to adjust the lips, do the outline on this one, and the fullness on the other side. You've seen the difference and you've seen the technique. It's right? It's okay for you?
Yes.
Okay. Now, I'm going to do the outline now. You see, I still have the bleaching of the outline. So now I'm going to do the red part now, like I did on the other side. So I go deep here. You see, my needle is here, is in the lower part. And I sculpt the gel with my finger. Do you see the difference now? Yeah. Okay, smile. See, big difference.
Yes.
Voilà. Okay, let's do the lower lip now. Now, same thing for the lower lip. Give me some swab and tissue, please. Always ready. Give me a close smile. Smile, but close. Yeah. Long smile. Like this. I reverse the lip. You see, she has a problem with the support. You see, the gum are very flat. So the lip is not leaning on the gum like a ski jump to come out. So it stays flat. Even when she smiles, everything stays flat. There's no support underneath to push forward the lip. So that's the problem. So I keep a close smile. I push with my finger. I try to reverse the lip. And here in the middle, it's okay. You see, I plump up the lip, not the outline, the lip. You see, I can control my filler. I still use Eracha, the number 2. Voilà. Look at the difference quickly. Smile. It's quite lovely. With one dot in the center, it's quite sufficient. Please smile. That's beautiful lips. That's why I call beautiful lips. She doesn't need outline. She's enough outline. For someone who had no lips, now she has, I think, lovely lips. That's definitely kissable lips.
Sometimes we find the lips where the lateral part is going inside.
Yes.
Is this the same technique?
Yes,
how
the
you
same.
want to roll it
The
out?
same, absolutely the same.
Yeah, okay,
You go
thank
like
you.
this in the middle and you try to, which is good for you anyway. Okay. Anna, Sarah, need you. Okay, I'm going quite deep. Here, you see the eyebrow? Can you see here? I'm pushing myself. Can you see?
Yes,
Yes?
yes.
So I'm going the temple area, the same way I did the other side. So I may be, what I'm going to do now, I'm going to do the work, not talking, so you can see at the normal speed how you should work. Okay, give me Teoxane Ultra Deep, get ready. Get ready. Okay. I'm checking always that my cannula is well locked. If not, you may lose the product. Always check before. All right. As you can see, I have no drawing, but I know exactly what I'm doing. Much better.
Now you use Ultra Deep.
Ultra Deep, yes.
Yeah. And before it was Ultimate.
Ultimate for the temple, yes. Ultimate is interesting for this sort of area because it's thick, high viscosity, it lasts very long. Vertical position is important. You go tangent like this. Your position is really important. Ask the patient to look up. You're really tangent. You don't want to go too deep. As I always said, when you put fillers, you are inserting fillers between the skin and the muscle, which I used to call that the wallpaper technique. It's like if you want to glue some wallpaper on the wall, so you put the glue in between. So the gel is the glue between the skin and the wall, the muscle. So if you put too much, you're going to be bubbly and even. You want just the right amount, not too less. It's okay, darling. Voilà. So fine. Okay. Same thing. Open your mouth. Open your mouth. I check. Am I even? If it's not the case, you spread out with your fingers. Do not hesitate to put your fingers. It's sculpting. It's not injecting. It's also sculpting. You really need to be hands-on, as we said. Put your hands on. Control what you're doing. Okay. I have to finish the chin area with a small cannula. Same thing. See, I'm doing the very super. Voilà. I repad this area. Everything has to be even up. There's no reason you improve the temple or the cheek and not the lower face, because that you need to readjust every area of the face. Something nice. Let's have a look. Seems okay. Maybe still a bit dented here from what I see. See a shadow. I used to work with, deal with shadows and light, so but it's quite tricky in this room. The light is not. Voilà. Swab, please. Let's have a look. I think it's fine. Looks good. Smile. Let me see the symmetry of the lips. I think this one is slightly fuller, a bit more swollen, technically. Smile. Big smile, yes. There's a slight difference. Maybe it's a smile. Tiny, yes, tiny. You need to, the lower lip is perfect. Cheeks are lovely. It's all very natural. See? Fresh, huh? Mm-hmm. That's also the temple. You can see the eyes are much more radiant, okay? They're sparkling. Your eyes are, well, because you have the shade. See, sort of shadows around the eyebrow. Now you got the lights coming back. You reflect the light differently. Chin area is much better. The projection of the chin is match the nose, lip, chin area. The angle is correct. Smile. Just a tiny, tiny, tiny adjustment too. That's it. Great. That's okay. Okay, as you can see, no lumps, no marks, no bruise, nothing. Ready to put some Teoxane skincare product and go home. Well, that's fine.
Yes, we see a great
Okay,
result.
I think we have the next patient.
Thank you very much.
Now we have Martina, which is lovely, same age, around 50, 40 something. She's more triangle shape, definitely not a square. So here she's quite a bit lumpy here. She doesn't need volume restoration in the lower face. It's definitely the mid face. Same thing, we have to define the anatomical unit. Be careful not to get involved with some area you don't want to deal with. Eventually you can, for certain people, deal with the tear trough here, which I'm not a great fan. Definitely not to get involved with the eye socket area here because it's going to be lumpy. She lost some volume in the mid-face, it's obvious. Here, you see I will stop here. It's quite lumpy here. Don't put filler in this area, it's enough. She has enough. So the shaping is more kind of triangle shape here. The temple is fine. Same thing on the other side. You see, it's quite lumpy here. Don't go too far. Don't go too low for her. She doesn't need filler in this area. We'll work with the fine lines above the lips to introduce you the RHA1. She has lovely lip shape. We're going to improve the lip also. Redefine the contour of the lip more than the volume, because I think she has a nice volume. It's more the definition has been a bit rubbed, and you have all these fine lines here. I'm going to try to fill, by doing the outline, the contour of the lip. I've been told to show you to do some injection on the nose. She doesn't have the real appropriate nose to be corrected because it's an excess of cartilage she has. It's not like a lack of something. She's an excess. So adjusting on some excess is always a bit tricky. I don't like to do it too much. So, but I'm going to put 1 or 2 drops to show you, to adjust. She lost the angle here. The nasolabial fold like correct, absolutely fine. Maybe we can also with the RHA 1 or 2 fill a few lines here. Let's go. I'm just gonna little prick, tiny, 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 tiny. I didn't do anesthetic. Keep that on the side. So I'm like gonna see very quick. I quite like this cannula. They're very strong, flexible but quite strong also. You see? Voilà. I don't interfere with the eye socket area, as you can see. Okay, done. The other one, please. Same thing on the other side. See, I didn't even no anesthetic. You don't need. It's quite simple. Here's my hole. Voilà, bim, boom. Look at that. Look at this hand. My right hand, because I'm left-handed. My right hand is working. My right hand is pulling. Okay, it's pulling. This is very important. You don't work with one hand. You work with two hands. So this one is pulling up. Show me the tension. Show me the direction. Show me where I should go. Show me where I should put my filler. Okay, I know exactly. With this hand, I know exactly where I am, what I have to do, and what I'm doing. Up, finished, quick. Alors, now we are turning around the lips now. I'm going to do the outline this time. RHA2, short needle. I check that everything is going properly. She has a lovely outline, should be easy, technically. Okay. I pinch the outline, if you notice. You see, my right hand is always working. She does 50% of the work. Voilà. You can see that. Voilà. It's a bit uncomfortable for me because I don't have the good light. So I don't really see what I'm doing, but it's fine. Open your mouth. Open your mouth. You can see you can adjust your filler by doing this. You reset the filler in the outline properly. You see you have a little dent on top. That we're going to do that with a different filler. Alors, RHL1, yeah, get ready. You see all along the outline, you can see you have this virtual root canal, which, you see, which is quite nice to announce again. We can do that for the lower lip also. Open your mouth. Give me a piece of tissue, please. Open your mouth. Open your mouth. Ah, okay. Outline of the lower lip. I put my finger in. I see the outline. As you can see. Do you see? Okay. It's more obvious than the upper lip to see the feeling of the kind of root canal. As you can you see it? Give me some Teoxane 2 again. To finish the. The product is coming out in front of you. Then you control what you do. Yes, fine. No, you don't move. Open you, don't move. Okay, close your mouth. Give me a big smile. Okay. Same thing. I have to sculpt my filler. Open your mouth. Open your mouth, please. To be sure it's even out all along the rim.
We could see it very nicely how the product sprites or
Smile.
is going in the channel.
Yes, absolutely.
Sehr gute Kamera, wirklich, wir können es sehr gut erkennen. Vielen Dank.
Give me a little bit more. I need to adjust. I see I need to do a little adjustment here. Yes. Very bad light. Okay, it's better now. Smile. Okay. Great. Well, so I reshape her lips. I didn't put volume. I just re-outlined the lips. Now I'm going to try to show you something I haven't done for a long time. I used to do, take me back to the old time, 30 years ago, when we used to do bleaching with collagen Zyderm in the 80s. That's what we could do in the 80s for the fine line above the lips. It was difficult to do recently with the even Teoxane Global or maybe some redensity. I don't know. I never tried it for this sort of thing. So this one is quite interesting. I like the way it flows, the way it can go in very fine lines. So I show you. Can you see this bleaching?
Yes.
You seen the bleaching?
Yes.
Voilà. That's what you should do. If not, you're going to have these little baguettes. That was the problem. If you use Teoxane Global, any filler with more viscosity of thicker, you're going to have these baguettes. Or if you inject even deeper, it's going to be really heavy and you look like a duck. You know, you have this heavy upper lip, which is really horrible. It's horrendous, and you can't do that. And so, you see, where is the fine line area? You see, I really pull tight with my fingers, and I'm going to do bleaching. Can you see that?
Yes.
So I remind you that this product is technically half cross-linked, half non-cross-linked, which is interesting. That's what you want. You want to feel the fine line, but you want to hydrate the area at the same time. Voilà. We have to go back to this old bleaching technique. Can you see it? Maybe you see it better than me, because I don't really see what I'm doing. I have a very bad light.
Which product do you use?
RHA1.
RHA1, also RHA1.
I think it's great for this sort of work that we couldn't do anymore, to my opinion, because the products were too thick to do this sort of work. And bleaching. I finished. Oh, it's too long for me. We had a dent on the upper lip. I'm going to try to fill it, to lift the area. Sometimes I have to lift the area. Okay. I'm rejuvenating this upper lip area very superficially by a bleaching technique. All the micro dents, the micro lines. So you will see when I will spread with my finger after, and even the whole thing is going to be great. Voilà. So it's an epidermic injection, very superficial. Wet?
Yes.
Tiens, prepare me some number 2 for the nose. And open your mouth. I'm going to, okay. That's what I do. Can you see?
Yes.
All the white dots I've done when I lift like this? Do you see it?
Yes, we see it, yes.
Okay. Now I'm going to spread it.
Mm-hmm. How much product did you use?
Oh, very little. On the one, I don't know. This is the one?
This is number 2.
No, but this is the one. For the upper lip, I use like 0.3 ml.
Also 0,3
Very little.
0,3 Milliliter RHA1.
Open your mouth. Close your mouth. Right, and okay. I'm going to let this thing settle a little bit. Open the mouth. Okay, I will adjust maybe again. In the meantime, I'm going to do a little bit on the nose just to show you the number 2, RHA2, short needle. Try to fix some, as I say, I don't think it's the right proper indication because she has an excess of alar cartilage. So it's more, she needs more reduction than some, but she still has a little dent on top. I'm going to try to smooth the whole thing, yes. You see? I can smooth. So it looks less irregular.
Hier wird jetzt das RHA2 verwendet, RHA2.
Voilà, RHA2. That's quite nice, in fact. See? Quite cool. Quite cool. Just have a look where your product is coming out. Okay, voilà. Small adjustment on the nose, small adjustment. Now, this is number 2. Number 2, I'm going to do also, I can do with number 2, I can do with number 1. The same technique I did on the upper lip, sort of bleaching. Like that, you don't have this problem with injecting too deep in the glabella and have this intravascular injection. You don't take risks, you stay very superficial, bleaching technique, easy. Because in fact, they have fine lines, they're not really deep. They won't disappear with Botox. You need to soften them. That's what you want. So this can be done with number 2, number 1. Number 2, it will last longer, obviously. And I think it's the idea. I love this number 2. I think it's a great product. Every day, when you will have it in hand, you will see it flows. It blends perfectly with the skin. That's what we want. We want something to blend perfectly with the skin, even though when you finish the work and you spread it all, you can't feel it. You know, you can't even feel you put some fillers. So this is nice. So here, I'm going to reduce, the angle is a bit too deep. I pinch, I'm quite careful. I don't go too far. That's why I use 4mm needle. I don't want to take the chance to go too deep and to inject intravascular. So you see, I pinch, I control. You have to keep in control, huh? It's very important. Okay, some swab. I hate this swab. You don't have Okay, I think it's done. So I've done some nose reshaping, as we could call that. It's quite interesting, in fact, because as you can see, the alar cartilage are less prominent. The tip is softer, rounder, which is in a way less aggressive, maybe, for the eyes. We have no bruise. That's very important. You're doing cosmetic medical treatments. You're not doing surgery. Patients should not be bruised. They should be in and out. No downtime. They hate downtime. They don't need the downtime. Nobody wants downtime. Nice. Nose is nice. I think we have a good surprise with the nose. Okay.
Yes, it looks nice. The RHA
seems
to be very
much
smooth.
more elegant the nose. You saw,
Yeah.
One thing was important is the angle, the angle between the nose and the forehead here. Okay, it was too deep, so it's much more elegant. We have sort of what we used to call Greek nose. I don't know if the German like to call that Greek nose anymore, but and tip of the nose, you see? In fact, we don't, yeah, it's a bit bulky, but not so. I need to adjust a little drop on the nose. Give me the pencil. I can see that's what you have to finish your work. You see, it's fine. If I put a drop here, it will be much better. Lips are fine. Smile, quite lovely. Have a nice definition. Need to put a droplet here also, tiny. Here, you see, I can do better because I really don't see anything when she's lying. I have a terrible light. Here, try smile. Okay, this is a kind of difficult dent she has here. Smile, big smile. The lower lip is fine. It's fine. It's a bit, maybe, no, it's fine. So one or two little things to
Gibt
finish
es
the work.
Fragen an Dr. Sebagh? Gibt es irgendwelche Fragen im Publikum? Can we ask question?
Let me check.
Okay.
I show you the way I finish my work because you need to adjust.
Okay.
Before you finish, you need to adjust. Let's see the volume. Smile. I think she has more volume here than here, from what I see. Relax, yes. So I need to put a little bit more here. You see, that's the way you do your work. Okay? When you finish, you adjust the symmetry. So I'm going to do 2 or 3 refinements, Teoxane Ultra Deep, and number 2, the nose. Okay. I have this little problem, this dents here. Open your mouth. Look at that. I put my finger underneath. I have these sort of lines. So, Teoxane 2, 30 gauge needle, boom. I lift the whole thing. Same thing on the other side. Open your mouth. You see, I go like this. Simple. Okay. And I want to finish my cheek. No, yeah, but Ultra Deep is long, can you? Yeah. You do it. You put it. Small refinement on my cheekbones here. I still have my needle all open, ready for me. Voila. So sometimes you need more volume on one side than the other one. So I'm doing some adjustment. I think it's enough. Voila. I think I will have more symmetry and more refinements on the details. This is much better too. Smile. See? Nose is better. And cheeks. Open your mouth. Let me check. I need to spread. A bit bulky inside. Let me see. Smile. Fine. I'm pleased. I think it's fine. Good.
Great
Fine.
result.
Now you
yes.
can ask questions if you want.
Okay, great result. Thank you very much.